The factors in deciding which treatment to administer, either FOLFIRINOX or gemcitabine nab-paclitaxel, are as we described. What does the patient want in terms or is willing to tolerate in terms of toxicity? Both regimens do cause neuropathy. They cause low platelets. And then there's the challenge of what we do sequentially. What treatment do we have available that is FDA approved, category 1 recommended in the second line? So that's why I think more and more we're using gemcitabine nab-paclitaxel in the front line and then proceeding to 5-FU-based therapy with Nal-Eri. Now, the patient is 57 years of age, and so we also have to incorporate that into our decision making. And we should back up and remind ourselves that that is a relatively young age for the development of pancreatic cancer. The average age is right around 72. So this patient has developed a early pancreatic cancer. We want to know if there are any important hereditary syndromes such as BRCA, such as Lynch syndrome, that we need to consider. Those syndromes, there are treatments such as PARP inhibitors or checkpoint inhibitors respectively for those syndromes. Looking at his comorbidities, he has hypertension, he has glucose intolerance, and not frank diabetes. He's not requiring insulin, obviously. But we want to monitor that and focus on, if there are any aberrations, correcting them appropriately. Now, this patient is 57. They're probably still working. We need to think about some of the logistical issues of our regimens. So giving FOLFIRINOX is associated with having to wear a pump, getting a port, and typically patients that have to work, they'll come in on a Wednesday, have the pump disconnected on a Friday, try to rest up through the weekend and get back to work on Monday or Tuesday. We contrast that with nab-paclitaxel gemcitabine, which is given weekly. It allows us to monitor the patient closely. So we'll treat them on a Friday. They'll come in, go home, recover Saturday, Sunday, and be back to work on Monday. And then we can determine the following Friday whether they should continue with treatment or whether there are reasons such as neutropenia or neuropathy that don't allow the weekly therapies. So there's a little more opportunity to adjust the doses with the gemcitabine nab-paclitaxel regimen. And that may be important, again, for a person that needs to work, that does not want to be burdened by the pump. So very important.